Vice Chief Quality Officer for the University of Oklahoma and also the University Chief COVID Officer. I'm going to give you a quick update on where we are this week with the pandemic in Oklahoma based on the current numbers. And then I want to highlight 3 studies that have been published this week that have gotten a lot of attention. I think they're important to make sure that everybody is aware of those. So right now in Oklahoma, we had 942 new cases that were confirmed today in the state. We're just over 67,642 cases with 888 deaths that have been reported since this pandemic started. Within the past week, that's 5,600 new cases confirmed, which is up a bit, but the number of deaths are down, 44 deaths over the past week, and as I'll highlight in just a moment, hospitalizations have been slowly coming down now for the past 4 weeks, which is good news. Sadly, we're still at 800 new cases per day on average in the state, and that has been trending upward now for the past couple of weeks. The other metric that I watch very closely is the number of tests that are actually positive that are done in the state. And right now, so far this week, we're right around 10% of the specimens that are being tested are positive. As I mentioned, hospitalizations are down. We're just over 500 hospitalizations in the state, and the number of people in the intensive care unit has gone down because of that, but we still have about 180 or so patients in the state that are in the intensive care unit. So we'll continue to see some deaths occurring in the state. I did look at data on the distribution of deaths in the state, and again, the vast majority of deaths that are happening in the state are occurring in patients who are 65 years of age or older. I wanted to highlight 3 reports that came out this week that I think are important to remember. The first one was a study that came out in Morbidity Mortality Weekly Report from the Centers for Disease Control, and they highlighted what number of people have delayed medical care because of COVID-19. And in this particular study, they found that about 41% of adults had either delayed or avoided some routine medical care. That's really important because I think we're all concerned that we're going to see the consequences of delayed care eventually starting to catch up with us. So for instance, people who delay or avoid cancer screenings may result in substantial new numbers of cases of cancer that are more advanced in the future, which would increase the morbidity and mortality from cancer. Avoiding care for things like diabetes and hypertension can lead to increased numbers of strokes, heart attacks. So it's very, very important that people remember that most healthcare settings now are very safe. Healthcare systems have put into place all of the procedures to keep people safe, and please don't avoid medical care that's necessary. And remember preventive care because it's very important this time of year. We'll probably talk about it more, but one thing that I certainly want everybody to remember is to get their flu shot this year because that's so very important as we approach this fall and the influenza season of the year. The second article I'll mention also was published in Morbidity Mortality Weekly Report from the CDC, and it was an interesting story. It got a lot of national press today, and it's about where people are getting infected in the community. And in this particular study, and it wasn't a large study, I'll highlight that, they had just about 314 people in the study, 154 patients who had COVID-19, and then they tried to find match controls, 160 people who did not. So it's a case control study where you're looking at people who are infected and you're looking at people who aren't infected but have similar characteristics. And of course, the large national news this morning was that about 3 times as many of the people who reported positive COVID-19 also reported that they had gone to a restaurant, and about 4 times as many said that they'd gone to a bar or a coffee shop where they could have potentially been infected. The other thing I wanted to point out in this particular study, though, it was a small study, but if you look at the graphic that's in the handout that I'll distribute after this press event, it highlighted that the other 2 areas where there was concern that did not reach statistical significance was gyms and religious gatherings. Again, neither of those reached statistical significance in the study, so they weren't discussed in the national news. But had the study been larger, had it included more people with COVID-19 and controls, if those same trends had continued, then those would have been significant also. So the point I make is, remember that anytime you go to a setting where there are people, particularly indoors, and they're not in a mask, you increase the risk of transmission of this virus. The final article actually came from Good Housekeeping, and it was a discussion with a virologist and an infectious disease specialist talking about, can we safely trick-or-treat this year for Halloween? And I agree with the 3 points that they made in this particular article. Number one, remember, it's getting people together in close settings, particularly if they're not in a mask, that will increase the risk of transmission of the virus. So, if you're going to go trick-or-treating, try to avoid doing it with a large crowd of children together, because that would increase the likelihood of transmission from one person to another. I know that many communities like to have events, either parties or other events where they bring lots of kids together so they're not out in the community. That may actually not be a safe idea this particular year, because a couple of kids from a family out trick-or-treating is probably relatively low risk, particularly if they agree to wear a mask. Second, the face-to-face interaction during trick-or-treating is typically not a big mask underneath it, both to protect them and also to protect the people around them. In the interaction, typically from trick-or-treating, if you're only at the door for just a few minutes, that risk would be relatively low, but remember that it would be safest if the kids were wearing a mask. And then finally, don't forget about hand hygiene. The risk of transmitting COVID-19 on the candy or other items that a child might get from a home is actually very, very low. But one way you can dramatically even reduce that risk further would be to do hand hygiene. So teach the kids how to wash their hands, use hand sanitizer before they're opening candy or other things that they've received from other people. So those are the 3 things I wanted to highlight about trick-or-treating this year. I think it can be done safely, but again, most importantly, try to avoid crowds, wear a mask, and do frequent hand hygiene.
And did you mention then also the people that are giving out the candy wearing masks? And
yeah, so I think it would be very important that particularly if you're in your home handing out candy or other things to kids that do come trick-or-treating, the courteous thing to do would be to also be in a mask yourself. Again, one of the principal reasons we wear a mask is to reduce spread of the illness from one person to another.
Might be a fun opportunity for the grown-ups to wear costume masks type things too.
As long as they use something that will actually cover their mouth. So if you're wearing a plastic or some type of a mask, just make sure that you have something under it to capture those drops so they don't come out of your mouth.
Okay, that's great information. Kevin with Telemundo was asking about why are cases continuously increasing, specifically in Oklahoma County, despite there being mask ordinances across the biggest cities?
Well, so the question is, why are we continuing to see increase in cases at the same time that we have mask mandates in some of our bigger metropolitan areas? When you look at the report, so at first I would say not everybody is wearing a mask. Second, as that CDC study showed this morning, people are getting infected in settings where they're not wearing masks. That's the most common. So remember, the most common place that people get infected is in their own home. So if one person is infected, and typically you're not wearing a mask in your own home, your increased risk of transmission of the virus from one person to another in your home is quite high. And then, as we mentioned, bars, restaurants. When you look at the demographic in Oklahoma of the number of new cases in our state, the biggest demographic is people who are 15 to 24 years of age, with the second one being 25 to age 38. So it's young people, social and mobile people, who are in the community that are getting infected. Colleges, high schools, and others may be driving some of that transmission because it's young people coming close together. And again, if they're in settings where they're not wearing a mask, we increase the likelihood that there will be transmission from one person to another. So again, it's trying to avoid those circumstances where there are a lot of people without masks.
In the past, you've talked about how there's a lot of false negatives, not necessarily false positives with testing, but false negatives. What are the things that would cause them to be? Is it the way that the sample is being tested, or is it the way the sample is being taken, or is it just a lot of different things could cause false negative?
False negative tests. So whether we're talking about PCR test or the antigen test, both can have false negatives, and there are a variety of different reasons. So sampling could be part of it. If you don't get an adequate sample, why you could potentially get a false negative test in a person who's infected. But we also know that the amount of virus that a person sheds when they're infected varies on where you're at in the course of the illness. So we know that if I get infected today, I'm exposed to somebody and get infected today, if I get a test tomorrow, it's very likely going to be negative, even though I'm infected, because I probably won't have enough viral load to actually be detected as a part of the test. And so that's why we recommend for the PCR test that you typically wait 5 to 7 days after direct exposure before you get a test, because we know that most people who get symptoms will start having symptoms somewhere around 5 days, and we know that people have the most virus shedding usually in a day or two before they have symptoms, and then when they have symptoms, that's when there's the most viral shedding. So if you do it too early, you can get a false negative. If you do it too late, a person could have the full-blown infection, but if they get tested too late, as the virus starts to drop off, the test may come back negative. The same thing holds true for the direct, the antigen testing, the rapid test, that depending on where you're at in the course of the illness, you may or may not have enough of the viral protein in the specimen to actually be detected by the test.
Interesting. But even if you don't have enough of the viral protein, and you could, even during that period of time, even though the test couldn't pick it up, you could still potentially infect people.
Well, certainly you could potentially infect people, but remember, you're most likely to infect people when you have the highest viral load, when the most virus is coming out. But if I get, like I say, if I were to be exposed and infected today and get tested tomorrow, there's a good chance the test would come back negative. And so we don't recommend that people run out and get a test immediately after direct exposure. You should isolate, because you could be infected, and then wait a few days before you get a test done.
Okay. So several people have asked, OU's season opener tomorrow. Can you just talk about the things that are being done to protect those participating?
Yeah, so opening day for the Sooners tomorrow. The football stadium has been prepared for the first game. As you know, we'll have only 25% capacity in the stands. Anybody that perhaps watched the NFL football game with Kansas City last night showed what a stadium with about 25% capacity might look like. All of the seating will be separated. Family groups that's set together will never have to walk in front of other family groups to get to an aisle because of the way that the stadium is set up. It's set up with staggered seating so that there will be good physical distancing within the stadium. And of course, as everybody knows, OU has an official policy that on game days, you must wear a mask from the moment you get on campus. All students, staff, fans, everybody must wear a mask on campus on game days because it may be a little more difficult to do some of the physical distancing that'll be required. But from the moment you arrive on campus, of course, you're going to see signage about making sure you're wearing your mask. When you go to the gates of the stadium, you're going to notice that everything is touchless in terms of scanning your ticket into the football game, into the stadium. There'll be physical distancing, separation through marks on the pavement and others to keep people physically distanced. Once you come in, many people will be encouraged to use the stairs rather than the elevators if you're able to use stairs, because that will allow us to maintain better physical distancing and not crowd people into elevators. There will be attendants at all the elevators that will be limiting the number of people that can get in. Once you're in the stadium and in your seating, again, you'll be physically distanced from other people. If you decide to go and get to some of the vending areas or to get condiments or things like that, all of that will be physically separated, and there'll be people watching to make sure that we maintain physical distancing in those settings. Even the bathrooms, the restrooms in the stadium will have attendants to control the number of people that walk into the room at any one time. So they've done everything they possibly can, I think, to keep people separated, keep them safe. We have an absolute policy that people must wear a mask in the stadium. I have to say, watching the NFL game last night, I was impressed that the majority of fans were wearing a mask continuously. I mean, when the cameras panned around the stadium, the people were in masks. People on the sideline were in masks. Andy Reid, the coach, was in his face shield. I was very impressed that they really promoted those public health practices.
That's great. One person was asking that bar capacity is estimated to be at 75% on game days in Norman. Is that troubling or?
Well, so as we saw from that publication this morning, restaurants and bars clearly are an area that people who get COVID-19 often report that they visited, and with greater frequency than people who do not get COVID-19. I know that many of the bars, restaurants in Norman are doing everything they can to promote outdoor seating, which is much safer, obviously, than indoor seating. And they're going to have reduced capacity. The city council, I guess, settled on 75% capacity inside of the bars to reduce the number of people that are indoors. I just tell the fans, just remember, if you're in an indoor setting, in a place where people don't have their mask on, you increase the risk of transmission and getting the virus.
Jacqueline at K4 was asking about that we've seen a number of positivity rates on OU's campus bounce around in the last few days. On September 7th, it was 11.8%. September 8th, it was 17%, and on the 9th, it was 9.3%. Can you kind of explain how that?
Yeah, so the question is about the testing that we're doing in the Student Health Center on the Norman campus, because we are transparent and do post the rate of tests that are positive. That number has bounced around a lot. A couple of points I'll make. Number one, the number of people being tested varies substantially by day, and so just because of the number of people being tested, we may see that number fluctuate quite a bit. I think we hit 30% one day, but it was a smaller group of students that actually got tested. Second, the people that go to the health center to get tested are self-selected. In other words, they're more likely to have one of two things. They're either symptomatic, which you would expect a higher positive rate, or they're people who are living with somebody or been someplace with somebody who's a known direct contact. So we expected to see higher percent positive rates in that clinic because the students self-select who comes to the clinic to get tested, and it's often people that have had contact or are having some symptoms. Again, when you look at the overall number of students that have been infected, we wish it was zero. It's not. But when you look at the overall numbers in the context of the size of the Norman community that we have at OU, with about 38,000 students, staff, and faculty on campus potentially, it's still a relatively small proportion of our total Norman community.
Okay, so let's talk a little bit about long-term issues that people who maybe are younger and are even asymptomatic, but they have COVID, talking about long-term health effects that they might have.
Yeah, so we've talked about this before, that there are good studies that show that 20 to 30% of the people who have symptomatic COVID-19 will have some persistent symptoms for usually several weeks, which most commonly, by far most commonly, are either cough or some shortness of breath. And the other one that sometimes persists for a while is loss of taste or smell. So those symptoms are actually pretty common and may last for several weeks after a person has recovered from COVID-19. Remember, most of this is in people who are symptomatic, not the asymptomatic people. The big concern has been, do asymptomatic people have long-term effects of the infection that maybe they don't recognize because their symptoms were either so minimal or others? And there are some studies that have suggested that if you did detailed testing of the lungs, that they may have some abnormalities, but most of those don't appear to have long-term sequelae. The one that we've worried about the most recently has been myocarditis, or inflammation of the heart muscle. There was a study that came out of Germany that looked at middle-aged men who had had COVID-19. They did very sensitive, what are called cardiac magnetic resonance imaging studies, MRIs, on those, and they found that about 70% of them had evidence of myocarditis. But a couple things that are important to remember from that study. First, these are all symptomatic people. Second, they were middle-aged and more likely to have cardiac problems. Third, there's been a lot of criticism about the sensitivity of that MRI because it may be picking up things that are insignificant. And so the point being that if you have two different people interpret the same scan, they may not get the same result. And so this is a whole new field that's being, this whole scanning for myocarditis in COVID-19 is new. There are studies ongoing now across the country looking at young college-age athletes who develop COVID-19 that are measuring their blood levels of enzymes of the heart. They're also measuring things like their echocardiogram to see how strong their heart is and doing cardiac MRIs. I think we're going to have a good picture of what the possible incidence is of any long-term effects, particularly myocarditis in younger student athletes over the next few months as more of that data starts to come out. But again, we don't want anybody to get really sick. But we still don't know exactly how to interpret the results of some of these early studies that have come out.
All right, well, I don't have any other questions. Is there anything you want to wrap up with?
Flu season, don't forget your flu shot. It won't be long before they'll be readily available everywhere. And it's going to be so important this year that people get their influenza vaccine. One study I'd highlight came out of Brazil that just got done with flu season, because they're in the southern hemisphere, and they found that individuals who had taken the influenza vaccine and who developed COVID-19 seemed to have less severe symptoms.